It's concerning that your mother experienced hallucinations, temporary blindness, and speech issues, yet the CT scan did not show evidence of a stroke. This scenario raises a few possibilities, including a transient ischemic attack, TIA, which can sometimes be challenging to detect through imaging alone, especially if symptoms have resolved by the time of the scan. Here are some follow-up questions and considerations to help provide more insight. Questions to consider. 1. Symptoms duration. How long did each symptom last, e.g. slurred speech, blindness, hallucinations? Did they resolve completely? And if so, how quickly? 2. Preceding events. Did she experience any head trauma or unusual physical activity before these symptoms appeared? Sometimes, events like minor falls or intense physical strain could trigger symptoms that resemble a stroke. 3. Medication history. Is she taking any new medications, or has she missed any doses of her regular medications recently? Some drugs or withdrawal symptoms can mimic stroke-like presentations. 4. Blood pressure levels. What was her blood pressure before and during her hospital visit? Extremely high or low blood pressure can cause symptoms similar to those of a stroke. 5. Other health conditions. Does she have any cardiovascular issues, like atrial fibrillation or carotid artery disease, that might put her at a higher risk for TIAs or strokes? 6. Hydration and electrolyte levels. Was there any indication of dehydration or abnormal electrolyte levels in her blood tests? These can cause confusion, hallucinations, and vision issues. 7. Diabetes and blood sugar levels. If she has diabetes, what was her blood glucose level when these symptoms occurred? High or low blood sugar can cause neurological symptoms. 8. MRI consideration. Did the hospital consider an MRI, which is more sensitive for detecting smaller ischemic events or changes in brain tissue compared to a CT scan? Sometimes, a CT scan might not capture smaller strokes or those located in certain areas of the brain. Possible next steps. Request for an MRI. An MRI can provide a more detailed look at her brain and detect subtle changes that a CT scan might miss, especially if the symptoms are suggestive of a TIA or other neurological condition. Neurologist consultation, a referral to a neurologist for further evaluation, including more detailed neurological exams and possibly monitoring, could be crucial. Monitoring symptoms. Keep a detailed log of any further symptoms, including timing, duration, and triggers, as this information can be helpful for healthcare providers in diagnosing and managing her condition. Follow-up tests. Additional tests like a carotid ultrasound, EKG, or even an echocardiogram may be useful in identifying any cardiovascular issues that could increase her risk for stroke-like symptoms. It's essential to keep monitoring her condition closely and advocate for further tests if her symptoms persist or recur.